to discuss from seasonal sniffs and sneezes. So today we are going to discuss why in winter especially we get a cold and what does the flu and cold are related. And for this to answer all our queries, we have invited an eminent doctor, Dr. Sujitha from Devdas Hospital. She is a pediatrician, so she is going to answer all our queries for today's live session. So let us welcome our doctor today.
Hi.
Hi,
Hi.
doctor. Good morning.
Good morning, everyone. I think today's topic is going to be very useful because many kids become sick during this winter season, and I think this session will help how to prevent this children getting sick during this winter season. I think this session is going to be helpful.
Yeah, yes, doctor, you're right. Actually, parenthood is a one of the phase where you have difficulties too. So, as a parent, so they will be very worried about our little ones, especially in winter. And for those who have got their babies, little ones just delivered, so they will be more conscious about this winter season. So we will discuss about that today, doctor. And I hope it is useful for all our viewers and who has asked questions regarding this to differentiate and to help regarding this common cold and flu. So let us start our session, doctor. So before starting, we have a question: whether this common cold and flu are they related, or are they the other name of common cold is flu, and how can we prevent this, or what are the symptoms regarding this flu and common cold? So can you just give me in a detailed regarding this common cold and flu, doctor?
Yeah, many people have this doubt whether common cold and flu is same. Actually, it's not same. Common cold is different and flu is different, but both are caused by viruses. But common cold is more common and it is caused by so many viruses, especially adenovirus, parainfluenza virus, seasonal coronavirus can cause common cold. Whereas flu virus is caused especially by this influenza virus, which peaks especially during this winter season, especially during the summer September to December. This season is the flu season. Both symptoms might be same, but the common cold will be very gradual and the symptom is very low. Whereas compared to flu, the symptoms will occur very fast. Even after 1 day of exposure itself, the child starts showing symptoms. But these might be which is very severe, and this sometimes when a child might be requires to visit the doctor. So the main thing is that both common cold and flu is caused by viruses, but the virus's intensity will be more in case of flu compared to this common cold. And how it spreads is more important because especially it spreads among kids because of coughing, sneezing, and then touching these respiratory droplets in the objects, and then they are again touch their face and nose. So this is the main mode of spread. That's why it is more common in kids because they won't wash their hands properly and they cough and sneeze and then touch their mouth and nose. This is one reason that the flu spreads among the children more frequently compared to this adults.
Okay, doctor. So from this, we should make our teach our children to be hygiene. What is the importance of hygiene to prevent the flu? And doctor, what are the signs and symptoms of the flu in children?
Both flu and common cold will present same. Similarly, like the child might have some fever with some shivering that we call it as chills and rigor. Mother will complain that whenever my child is having fever, he has some shivering and wants some blanket. This is called, we call it as chills and rigor, and the child might have some running nose or stuffy nose. Sore throat might be there, and in case of flu, there might be a severe body pain, headache, and even your eye discharge can be there. These are some of the symptoms. Sometimes a child might also present with vomiting, diarrhea also. These symptoms will help you to diagnose whether your child has fever or common cold or flu. If your child has any one of these flu symptoms, you can treat it at home. But if the symptom becomes severe, you can take it to the doctor immediately.
Okay, and doctor, actually, as you know, we have a habit whenever we have a cold or fever, at a instant in the first day, we don't approach to a doctor because we think that we let me check the other day if it is getting severe, then only I'll be reaching the doctor. So In such cases, when should I take a particular time? A parent should take their child to the doctor in
Uh,
flu.
what are symptoms I have told? If your child has any of the symptoms before I mentioned, you can wait for 1 or 2 days. But if the fever is not settling for more than 3 days, and even after giving medication, if the fever is more than 1 or 2, and fever and the child has some trouble breathing, that is, the child has some difficulty in breathing or has some noisy breathing, and if your child has some ear pain, and if your child is not even taking a proper diet, even not even taking solids and liquids, and if your child is dehydrated, you can see that your child is not taking food and is not passing urine for more than 8 hours, and even while crying your child tears is not there, then the child is severe in dehydration. In such cases you have to take the child immediately to the doctor. And if a child has a history of febrile seizure, that is, every time if a child has a seizure while having a fever, then it is important to take your child immediately to the doctor. These are some warning signs. If your child has, you have to see the pediatrician immediately so that it doesn't worsen.
Okay, okay, doctor. And what is the treatment for flu?
We can be divided into three categories: category A, B, and C. Based on the symptoms only, the treatment is going to be there. Category A is nothing but only the child has a mild fever and cough. If the child has these symptoms, you need not worry. You can treat it at home itself. You have to give an adequate hydration with rest, and you can give some paracetamol and cough syrup. The child will be settling. But in case of category B, already I told the fever is not settling and has a severe cough, which disturbs their sleep, and they have some sore throat and body pain. Then you have to see the doctor. Then they'll be prescribing the antiviral medications. What we call it as oseltamivir. It is available in the syrup. We can be giving the drugs like 2 times a day based on the weight of the child. And this antiviral drug should be taken at least for 5 days. But if the antiviral drugs is started within 48 hours of the symptoms, then it will be very good. The prognosis will be very good. And the category C is the emergency. That is what I told. What if your child has some trouble breathing, ear pain, and is very dehydrated? In such condition, your child might need admission because we have to correct the dehydration and electrolyte imbalances, and we have to prevent the fever also, because if the fever goes beyond 1 or 2, the child has an increased frequency to get the seizure also. Then we also prescribe antiviral medications. But this category C might require admissions for at least 2 to 3 days unless the child gets stabilizers.
Okay, doctor. And as you said, doctor, based upon weight, we are going to give antiviral drugs to the child. So as you see, the above 1 year, the we can understand the symptoms like the child has fever or running nose. At the time of those parents who have a month-old babies, like 3 months old, 7 months old. So for these people too, we are going to give the same antiviral drugs, or they are treated in a different way for the flu.
That till 6 months to 1 year, we'll try to avoid this antiviral drugs because they are just now they are developing the immunity. So we need not give this drugs, but we can just give some nebulization, saline nebulization, and we can control the fever. But we need not give antiviral before 6 months because the immunity is just now developing, and antiviral is not going to work on the kids. So if your child is less than 6 months and has symptoms of cold or flu, you just supportive measures, or that is you can continue your breastfeeding, and you can give fever medications, and you can give some saline nasal drops, and you can get your nebulization also. That's why it be helpful for 6-month-old kids.
Okay, thank you, doctor. And doctor, actually, the school going kid, if he or she is affected with flu and they are undergoing treatment, and when a parent can feel safe to send their child to the school.
Actually, this is more important because if your child still has the symptoms and fever and you're sending your child to the school, this is not only going to worsen your child, it will be going to spread this to other kids also. There is increased chance of spreading this flu to other kids also, and your child might take some more time to recover also. So it's better to till the symptom resolves. It's better to keep the child in the home itself. at least the child should not have fever for at least for 24 hours without medications. Then if your child is taking proper diet and child is well, then only you can send your child to the school. So better if your child still has no fever for 24 hours, then you can send your child to the school.
Okay, okay, doctor. And actually, we have, as you said, to follow the hygiene, especially in winter season, to avoid the contact with the contaminated uh, things, so that doesn't transfer to the other healthy child. So, may have a question. I have followed the hygiene, and I used to wear my child warm clothes. Though I get my child gets affected with flu, so how can I prevent this flu? Is a question. So, what can we do for this?
That's what. First thing is I already told, hand washing, proper hygiene and proper diet, everything. But even after following this, also if your child still has a flu, then the main thing is that immunization. Because currently there is an immunization for flu vaccines is available. We can give even for a 6-month-old. We can give a flu vaccine. There is 2 doses available at 6 months and 7 months. We can give it 2 doses, and if your child is more than 1 year, we can get a flu shot, one shot every year before the rainy season, because that season, during the rainy season only the flu peaks. So before September itself, you can get your flu shots. But one thing is that I have gotten my flu shots this year. So I may not get it next year. No, you should get it next year also, because the strain changes every year. So every year the vaccine also will get updated. So better you vaccinate your child, because this can prevent at least 70 to 80% of the flu infection. Along with this, your proper hand washing is essential before eating and after playing. After washroom, the child should properly wash their hands, and they should take an adequate diet. And especially if, you have to teach your kids while coughing and sneezing to use a kerchief or a tissue, and ask them to cough not like this, because if again the respiratory droplets is in your hands and the child is going to keep it in their face and nose. So better ask them to cough or sneeze like this. This is what we call as the elbow technique, so that their cough and sneeze won't spread, and this can prevent the spread of this flu in this community also.
So that's quite informative, doctor. So the technique you have told, actually we used to cough we keep our hands straight to our mouth and we used to cough or sneeze. So here after eating, we should follow this technique which you have said. So okay, doctor. So next, moving on to the next question. So how long does a child can be with a fever? Is it safe to have 7 days fever?
Actually, unless your child has fever but is active and has taken proper diet, the color of the skin is good, that is just not pale or blue, and is passing urine at least 2 to 3 times a day, and is taking adequate diet, you need not worry. But like that 2, 3 to 5 days you can wait. But more than 5 days, if your child has fever, then it is something serious. So it's better you have to see the doctor. And especially if your child is less than 3 months old, even one fever spike, you have to go to the doctor immediately. Because even one fever spike, that indicates that your child, 3-month-old baby, is having some infection. So in such condition, you have to go to the doctor immediately. But otherwise, you can wait for 3 to 5 days. But if your child, along with fever, if they have some kind of any red rashes in the body, ear pain, or any difficulty in breathing, or any swollen joints, or anything or rashes in the body, and they are passing some dark colored stools or any bleeding gums, this is something serious. If your child has fever along with this, and the fever is even not reducing after giving paracetamol, it is still 1 or 2, then you have to take your child immediately, because we have to do some workup and find out the cause for the fever. Because till 5 days it might be a viral, but if it is going beyond 5 days, it might be a bacterial, and it might be there might be a dengue, typhoid also. Because this season there is increased chance for dengue and typhoid. Because in case of dengue, the fever will be just for 3 days. Then after that there will be no fever. The parents will be very happy that there is no fever. But the main thing in dengue is that once the fever settles, there is increased chance for platelet drop. In that condition only, the child might develop rashes, dark colored stools, and bleeding gums. This indicates that your child's platelet is going to drop. So especially during this winter season, you can wait just for 3 to 5 days. But if it is going more than 3 to 5 days, better to consult the doctor immediately so that the condition doesn't worsen.
Okay, doctor. And actually, when you see during winter season, particularly, if we enter into a class with 50 to 60 children, they cough at a time. So, why do kids cough, especially in winter? So, are they going to be getting the flu? Is a symptom of flu that the child is constantly coughing, or there is some other reason that induces the kid to cough?
It need not to be flu that every time when a child coughs in winter. Normally, you can see the child might cough more during winter. This is because during this winter, the air will be dry. This makes your dry air, the viruses will be more in dry air and low temperature. And your immune system might be little compromised during this lower temperature. So this immunity might not be well developed. So you have a tendency to cough also. And another thing is that this dry air makes your nasal passage also dry, so that it makes your viruses to pass easily. So this might be one reason that your child might cough frequently during the winter. But if this cough worsens or disturbs their sleep and they have some trouble breathing also, and this might be one condition that we call it as asthma. This might be especially peak during winter season also. So if your child has this frequently every winter season, your child has some trouble breathing and requires any nebulization or even hospitalization, that might be one condition that your child is going to develop asthma. So better you do a workup and consult this pediatrician immediately if your child is having worsening cough every winter season.
Okay, thank you, doctor. And moving on to the next question. So, how we have to treat a fever in cold, especially in winter?
There is not much differences. It will be same only. But one thing is that during winter season, you can't appreciate the temperature with your normal hand itself, because if you see that if you touch your hands and legs of the child, it might be cold. But if you touch the forehead, it will be hot. That is what we'll see that we'll think the child has no fever. So it's better you check the temperature just in the forehead with the dorsum of your hand. You have to check if the child has a temperature, then if the child has fever, even if their hands and legs are cold, the child has temperature. So it's better to check with the thermometer at the axilla. If the temperature is more than 100.4, then your child has fever. In such cases, you can have to give paracetamol. Only by giving paracetamol, the fever is going to reduce. If your temperature is 100.4, you have to give the paracetamol according to the weight of the baby, and you can give every 5 to 6 hours once. You have to check the temperature. If the temperature is more than 100.4, we can give the paracetamol, and we'll ask them to do tepid sponging. But during this winter season, the child might, while doing tepid sponging, they might have shivering also. So better you can do a tepid sponging with a warm water, and you can control this temperature. And don't overclothe, because sometimes they think that during winter season, if the child has fever, they have to overclothe it. But don't overclothe it. You can cover your hands and legs, everything, but don't cover your head, because if you cover your head during the fever, your brain will fail to recognize the temperature increase. So it will be very hard to reduce the temperature. So if even during the winter season, if your child has fever, don't cover their head and don't over cover also, because this is going to increase their temperature and it will be very difficult to reduce the temperature. Otherwise, it will be same both. We have to give paracetamol and do a tepid sponging every 5 to 6 hours. Better to check the temperature through thermometer. It will be giving an accurate value.
Okay, as you said, doctor, we it is important to not to cover our heads, the child head during fever, because usually the parent, as they have more concern, they used to wrap the baby around the cloth and just you have to peek to see their faces. So thank you for that information. And doctor, what are the home remedies for cold?
Home remedies, that is what we can give some warm liquids, especially we can give warm water along with any soups. If you are vegetarian, you can give some mushroom soups or tomato soup. If you are non-vegetarian, you can give some chicken soup. This will soothe their throat because of constant cough. Because they will have some sore throat. This will be soothe their throat also. And honey is better. You can give it to the kids. But if your child is less than 1 year, try to avoid honey because honey can cause a bacterial infection, which we call it as botulism. But if your child is more than 1 year, 1 year to 5 years, you can give a half teaspoon of honey in a warm water, which will be helpful to soothe your throat because honey has antioxidants. If your child is more than 5 years, you can give a 1 teaspoon in a warm water. This will help to soothe your throat also. And another thing, most of the time, if the child has cold and cough, they have some nasal block. So that might be difficult for them to sleep during the night. They'll have trouble while sleeping because they'll start breathing through their mouth. That time you can hear some noisy breathing. So better you can give some saline nasal drops to relieve their nasal congestion also. And you can take your child to take a warm bath or warm inhalation, steam inhalation, which will be help to relieve this nasal block also. And if your child has continuously coughing during the night, you can get an extra pillow so that the child might sleep in an upright position. So during this upright position, it will be easy for your mucus to drain properly and cough gets reduced. So these are some of the home remedies you can follow it to control cough and cold in children.
Okay, okay, doctor. And doctor, actually, when kids have fever or cold, especially the 6 month or to 8 month babies, so parents have a concern that we should not make our child take a bath, otherwise it will get worsened. So, is it safe for keeping the babies without taking a bath for until the cold or the fever is reduced?
No, it's that's nothing. You can actually, if at the time of fever, don't take a bath. But if the fever is reduced, but during cough and cold, you can make the child to take a warm bath. You can take a warm bath because this is going to reduce their mucus thickness also, and it will be very refreshing for them also. So better you can take a warm bath during this afternoon itself, but don't take a warm bath during night. But you can take it in a daytime warm bath. You can take it.
Okay, and moving on to the next question, doctor. Which syrup is best for wet cough?
Yeah, I told what are previous home remedies you can follow. But cough medication, it's better you see a pediatrician and then you get prescribed because over counter medicines many are available, but you should not use it because you are doing a drug abuse. So better you can visit a pediatrician because we'll be giving for dry cough now. The best drug is dextromethorphan, which is going to suppress your cough reflex. But this dextromethorphan should be given after 4 years only. So if the child is less than 4 years, you should avoid giving any cough syrup with dextromethorphan. But if your child is more than 4 years, you can give dextromethorphan along with phenylephrine, which is a nasal decongestant. This is going to help your child. But if your child is less than 4 years but has a dry cough, you can just use only a phenylephrine nasal decongestant plus chlorpheniramine. In such condition, you can avoid dextromethorphan and you can just follow this home remedies what all I told. So it's better even after 4 years also you just consult your pediatrician because the dose will be different for different weight of the baby. So they'll prescribe the correct dose of the syrup because overdose is going to affect your child's health only. So don't overdose also, and it should be given only 2 to 3 times a day. Don't get like 4 to 5 times a day cough syrup to a child because they'll be becoming very sedated. It is going to be sedated and they're going to sleep full day itself. So these are the some of the cough syrup with dextromethorphan can be given for more than 4 years. Phenylephrine plus chlorpheniramine less than 4 years. And along with even whenever your child has cough, you start giving a nasal saline drops because whenever there is a cough, there might be some nasal congestion also, stuffed nose also. But treating a cough won't treat the stuffed nose. So better you can give a nasal drops along with cough syrup.
Okay, thank you, doctor, for insisting on to approach to a pediatrician whenever we have a cold in winter, rather than getting medicines from the medical shop and giving to our child. So it is a safer side to approach a pediatrician. So and doctor, some kids get sick mostly in winter season. Like the season changes, the kid will be like, I am favorite to the winter season, I'll get the fever or cold. So why do the kids get sick mostly in winter?
Because of winter season, everyone feel that they are very cold and they try to stay indoor. So this is one reason they are going to be overcrowded. So everyone stays in home in a close contact. This virus is going to spread fast. Even if the child in the, especially in the school, because of this crowded, overcrowded indoor activity, they are going to spread the virus easily. And actually, I previously told during this lower temperature, the viruses start spreading fastly. At this dry air also makes the viruses to spread fast. And another thing is that you are staying indoor now, you won't get proper sunlight because vitamin D is available during the sunlight only. So this vitamin D is essential for your immunity. So because you are not getting proper sunlight during this winter season might affect your immune system. So your immune system is already in a low level. So exposing to this viruses makes them more adaptable to this fever, cold, cough during this winter season. That's why the child becomes very sick during this winter season. So better, that's what I told. You can get a flu shot before this winter season and take proper hygiene measure, adequate. Even if your child has mild symptoms as well, advise them to keep in the home itself. Don't send your child to school with the symptoms because this is going to spread the infection more.
Okay, doctor. And doctor, actually, as you see in a class, there will be always a one child who is always sick and always takes sick leaves for 3 or 4 days. So the child parent has a concern that why my kid is getting always sick. So is it because of prematured? Because some babies are prematured. So at the time of their growth, is their immune system is going to be reduced? That's why they are more attracted to this winter flu or cold. Or some have more sensitive that they will even get in spring season. They will get allergies with the pollution, the polluted flowers. Even they get allergies, very sensitive. So what is the reason for this sickness?
That's what you told. Preterm babies are more susceptible to infection, yeah, because their immunity is not well developed and they have some difficulty to coping up this immune system and they have some difficulty to coping up the growth and development. So, but even the preterm babies, only till 2 to 3 years, they'll have some difficulty in adapting. But after 2 to 3 years, they'll be like more like a normal children only. Their immunity will be same like this 3 to 5 year old children only. So you need not worry. But if your child is getting frequently getting sick, then you have to check your immunization schedule. That's why during first 5 years, every children has increased susceptibility to infection because their immune system is that time only they starts developing. It will be getting fully developed only after 5 to 7 years only. Till then they are very new to this environment. So every time when they are exposed to the viruses and bacteria, they get infected, then only they are developing immunity. So that's why the government is stressing on immunization, especially at least for 5 years. You have to be update on your immunization because your child's immunity is very less during this 5 year. So better you get vaccines up to dated, even typhoid vaccines, flu vaccines, pneumonia vaccines, everything your child should get because your child's immunity will be very compromised during this 5 years. But if your child is sick, but their weight is okay and tolerating feeds well and they are gaining weight and growth and development is normal, then you need not worry. But frequent the child my frequent my child is getting frequently sick, but the child's weight is not gaining or child loses their weight and there is any history of any immune disorder in the family, then you have to see the doctor because we have to find out any immune deficiency or immune disorder in the kid that might make the child to get sick frequently. So better you have to see the pediatrician because there might be many reasons that your child gets sick very frequently. Then we have to do a workup and find out the reason and treat the cause.
Okay, doctor. And doctor, actually, in cold, we the food tastes tasteless because we had nearly 3 to 4 days. We have cold, so we cannot smell. Food also tastes very tasteless. So, what are the foods we can have when we have cold or during especially in winter?
That's what I told. The warm liquids is more going to help you to soothe their throat. So you can give soups, warm soups, either mushroom soups or chicken soups. You can give even a warm water is going to help your child. And try to give some bland diet itself and easily digestible, because it will make your child to digest properly. So don't give some high sugar content food, especially even juices with sugar. Try to avoid fast food, fried foods during and caffeine during this cold season. You can give more fruits and vegetables, especially bananas, carrots, potatoes, citrus fruits, because these contains vitamins and minerals which helps to boost their immunity. So these are the foods you can take it, but try to avoid fast foods and fried foods, especially during this cold season, because this is going to aggravate their symptoms only.
Okay, okay, doctor. And actually, can we just feed our babies with a curd during winter season? Is it safe to take curd?
Yeah, you can take curd, because curd has a probiotic vitamins and minerals. So you can take a curd because it's going to give an immunity. But the main thing is that don't take it directly from the fridge and give it to the child, because this is going to aggravate their symptoms. But if your curd is, unless it is in a normal room temperature, it's not going to worsen the symptoms. But in some cases, if you find that if your child after taking milk and curd, the symptoms aggravates, then in such conditions alone you can avoid curd. Otherwise, you can give curd during winters, but it should be in a normal room temperature.
Okay, okay, doctor. And yeah, so we have come to our end for our live session. So thank you, doctor, for providing all the answers regarding the myths we had regarding the cold and flu. So it was very useful live today. So we have gathered a lot of information. And thank you so much for joining our live today, doctor.
Thank you. I think I've cleared some of your doubts. Even if you have some doubts, you can approach through Cureka. I can clarify your doubts. Thank you.
Thank you, doctor. Have a great day. So, guys, we have come to our end to our live session today. I hope so. It is very useful. And thank you so much for joining our live. And have a great day, guys. Thank you.